welcome to our channel. Today, we're diving into a crucial topic that every woman should be aware of: the 9 common signs of ovarian cancer that you should never ignore. You know me, I'm all about getting down and dirty with the nitty-gritty details of what goes on in our bodies. And trust me, this is something you don't want to sweep under the rug. Early detection is key when it comes to fighting this disease. It's like tackling a pimple. The sooner you address it, the better the outcome. We're going to equip you with the knowledge you need to take charge of your health. We're in this together, ladies. Let's get informed. Okay, let's talk bloating. We've all been there, right? That feeling of fullness, like you just ate a Thanksgiving feast, even when you haven't. It's usually nothing to worry about, maybe some indigestion or a little too much salt. But what if I told you that persistent bloating, the kind that just won't quit, could be a sign of ovarian cancer? You see, ovarian cancer can cause fluid to build up in your abdomen, leading to that uncomfortable, bloated feeling. Now, don't panic just because you experience bloating from time to time. We're talking about persistent bloating, the kind that sticks around for weeks and doesn't seem to have an obvious cause. If you notice you're regularly reaching for the antacids or loosening your belt a notch with no relief, it's time to take note. This is especially true if the bloating is accompanied by other symptoms like abdominal pain or changes in your bathroom habits. Remember, knowledge is power. Being aware of your body and the signals it sends is crucial. Don't be afraid to advocate for your health and talk to your doctor if you notice anything unusual. Early detection is everything. Let's face it, ladies, we're used to a little discomfort. Periods, cramps, bloating, we handle it all. But persistent pain, the kind that lingers or feels like a constant dull ache, that's a different story. When it comes to ovarian cancer, pelvic or abdominal pain is a major red flag. Imagine a tumor growing in your abdomen, pressing on your organs and tissues. That's going to cause some serious discomfort. This pain might feel like a sharp stabbing sensation, or it could be a dull, aching feeling deep within your pelvis or abdomen. It might come and go, or it could be a constant companion that disrupts your daily life. Pay attention to your body's signals. If you're experiencing persistent pain, don't just chalk it up to that time of the month or something I ate. It's always better to err on the side of caution and get checked out by a healthcare professional. We all love a good meal, but what if you suddenly found yourself feeling full after just a few bites? This change in appetite, known as early satiety, can be a subtle but significant sign of ovarian cancer. Think about it. If you have a tumor growing in your abdomen, it can put pressure on your stomach, making you feel full even when you haven't eaten much. It's like trying to inflate a balloon that's already half full. It doesn't take much to make it feel like it's going to burst. Now, this doesn't mean you should panic if you're not famished at every meal. But if you notice a significant and persistent change in your appetite, if you're struggling to finish even small portions, or if you're losing weight without trying, it's time to see your doctor. Let's be real, we've all been there, rushing to the bathroom, hoping we make it in time. But what if those frequent bathroom trips become the norm, a constant interruption in your day? Frequent urination, especially if it comes on suddenly and without an obvious explanation, like drinking a gallon of water, can be a warning sign of ovarian cancer. A tumor growing in the pelvic region can press on your bladder, making you feel like you constantly need to pee. And it's not just about going more often, it's also about urgency. That sudden, overwhelming urge to go, like right now. If you're finding yourself mapping out restrooms every time you leave the house, or if you're experiencing leaks or accidents, it's time to talk to your doctor. We live in a busy world. Juggling work, family, and social lives can leave us feeling exhausted. But when does normal tiredness cross the line into something more serious? Fatigue related to ovarian cancer is different from everyday exhaustion. It's a persistent, overwhelming tiredness that doesn't go away with rest. Imagine feeling like you've just run a marathon, even when you've barely gotten off the couch. This relentless fatigue can be caused by a number of factors related to ovarian cancer, including anemia, low red blood cell count, or the cancer itself sapping your body's energy. If you're experiencing extreme fatigue that's impacting your daily life, don't brush it off as just being tired. Talk to your doctor. We've all experienced the discomfort of an upset stomach or heartburn after a spicy meal. But what if those digestive woes become a regular occurrence, even when you're eating bland foods? Persistent upset stomach or heartburn, especially when accompanied by other symptoms like bloating, nausea, or vomiting, can be a sign of ovarian cancer. As a tumor grows, it can interfere with digestion, leading to a range of digestive discomforts. Now, don't panic if you get heartburn after a pizza binge. We're talking about chronic digestive issues that don't respond to over-the-counter remedies or lifestyle changes. If you're constantly reaching for the antacids, or if your heartburn is keeping you up at night, it's time to talk to your doctor. Back pain is a common complaint, often attributed to muscle strain or poor posture. But what if your back pain is persistent, doesn't seem to have a clear cause, and is located in your lower back? Lower back pain that's unrelated to physical activity or injury can be a sign of ovarian cancer. As a tumor grows, it can press on nerves and muscles in your back, causing pain that can range from a dull ache to a sharp shooting sensation. This pain might worsen at night or when you're lying down. It might be accompanied by other symptoms like abdominal pain, bloating, or changes in your bowel habits. If you're experiencing persistent lower back pain that's raising red flags, don't ignore it. Talk to your doctor. Intimacy should be a pleasurable experience, so if you're experiencing pain during intercourse, it's important to address it. Pain during sex, also known as dyspareunia, can be a sign of ovarian cancer, especially if it's a new symptom or if it's accompanied by other symptoms like pelvic pain or bleeding. Ovarian cancer can cause pain during sex for a number of reasons, including tumor growth, inflammation, or scar tissue from previous surgeries. This pain might be felt deep inside your pelvis, or it might feel like a burning or aching sensation. Don't be embarrassed to talk to your doctor if you're experiencing pain during intercourse. There are treatments available that can help. Ladies, we know our cycles like the back of our hands. We know when to expect our periods, how heavy they'll be, and how long they'll last. So when something feels off, when our cycles change, it's a sign that something's up. Irregular periods, unusually heavy bleeding, or bleeding between periods can all be signs of ovarian cancer. These changes can occur due to hormonal imbalances caused by the tumor or the tumor itself affecting the ovaries. If you notice any significant changes in your menstrual cycle, don't ignore them. Talk to your doctor. Early detection is key when it comes to ovarian cancer, and your menstrual cycle can provide valuable clues. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Remember, knowledge is power, and being informed about the signs and symptoms of ovarian cancer can make all the difference. Early detection is crucial when it comes to fighting this disease. So don't hesitate to talk to your doctor if you're experiencing any of the symptoms we discussed today. Don't forget to subscribe to our channel for more health tips and information. Stay healthy and stay informed.